When I first came to Cambodia in 2014, there were no speech pathology services for adults. We were a small group of volunteer speech pathologists teaching dysphagia management skills to public hospital medical professionals, doctors, nurses, and physical therapists. We would stay a few months a year, but when we left, nothing would continue. Any training we were doing was clearly not thorough and sustainable. Since 2017, we have set up a Cambodian NGO, have hired permanent Western speech pathologists living in Phnom Penh, as well as a dedicated Cambodian support staff. We have developed a rigorous dysphagia program and strengthened our relationships with hospital administrators and with the Cambodian government. Across 3 public hospitals, we now have 14 trained dysphagia clinicians.
បាទជំរាបសួរខ្ញុំបាទឈ្មោះម៉ៃវណ្ថាខ្ញុំគឺជា nurse ធ្វើការនៅមន្ទីរពេទ្យព្រះកុសុមៈហើយតួនាទីរបស់ខ្ញុំគឺខ្ញុំធ្វើការមួយផ្នែកគឺជាអ្នកជំនាញវិបត្តិនៃការលេបខ្ញុំបាទបានទទួលការបណ្ដុះបណ្ដាលជាមូលដ្ឋាននៅជំនាញនៃការលេបវគ្គបណ្ដុះបណ្ដាលដំបូងបានសិក្សាអំពីផ្នែកទ្រឹស្ដីនិងការអនុវត្តជាង60ម៉ោងក្នុងកំឡុងពេលនៃការបណ្ដុះបណ្ដាលនោះយើងបានរៀនអំពីកាយវិភាគដំណាក់កាលនៃការលេបការធ្វើ test screen និងការវាយតម្លៃពេញការរៀនរបៀបនៃការថែទាំអ្នកជំងឺដែលមានវិបត្តិនៃការលេបគឺជាករណីដែលវាមិនងាយស្រួលទេសម្រាប់ពួកខ្ញុំជាកលិនុបដ្ឋាពីព្រោះវាជាអ្វីដែលថ្មីសម្រាប់ប្រទេសរបស់ពួកខ្ញុំ
In our country, we have many patients who have dysphagia, such as stroke, head trauma, aspiration pneumonia, and we manage them with NG tube or gastrostomy for long term. Fortunately, after dysphagia training, our team could manage them well instead of those two by compensatory technique and rehabilitation that made the patient happier. And I can use this knowledge to manage my patient too, who had COPD and aspiration pneumonia. Since 2017 in Cosma Hospital, we start to have dysphagia team who evaluate and manage dysphagia almost every day. We start to have free, and the staff in hospital start to know about speech therapy and start to ask for help from our dysphagia team. I'm very happy to get this knowledge.
ការតែងតែមានវគ្គបណ្ដុះបណ្ដាលនិងផ្ដល់ជាគ្រូល្អមកពីបរទេសលើសពីនេះទៅទៀតបានផ្ដល់ជាសម្ភារៈទំនើបដូចជាឧបករណ៍ហ្វីជាដើមទាំងអស់នេះហើយដែលធ្វើឲ្យខាងមន្ទីរពេទ្យទទួលស្គាល់ពីសារៈសំខាន់របស់ការព្យាបាលជំងឺ dysphagia និងមានការផ្លាស់ប្ដូរបន្តិចម្ដង
I think one of the most complex things about setting up and maintaining this program is to make hospital leadership believe what we are doing is beneficial for dysphagia patients. As you know, it's really new for us. COVID-19 was an unplanned opportunity to test how sustainable the dysphagia programs were. We were happy to see that in most of the hospitals, significant parts of the program continue to run even without the Western speech pathologist going into to provide support. This shows how the skills of the clinician have evolved.
អ្វីជាច្រើនបានផ្លាស់ប្ដូរក្នុងរយៈពេល5ឆ្នាំក្រោយឧទាហរណ៍ដូចជាឥឡូវនេះខាងមន្ទីរពេទ្យបានរៀបចំសម្របសម្រួលដូចជាការរៀបចំធ្វើលេខកូដបង់ប្រាក់សម្រាប់ការវាយតម្លៃនិងការព្យាបាលអ្នកជំងឺ dysphagia លើសពីនេះទៅទៀតខាងមន្ទីរពេទ្យក៏បានអនុញ្ញាតឲ្យយើងអាចសរសេរលទ្ធផលចូលទៅក្នុងឯកសារអ្នកជំងឺផងដែរ
Stroke has become a focus for rehabilitation in recent years, and work such as the WHO's workshop on stroke rehabilitation in Cambodia helped us to convince hospital leadership that we need dysphagia services.
យើងនៅតែមានការងារត្រូវធ្វើព្រោះវាពិបាកណាស់ក្នុងការផ្លាស់ប្ដូរជំនឿរយៈពេលវែងនិងដំណើរការស្មុគស្មាញរបស់មន្ទីរពេទ្យខ្ញុំបន្តិចម្ដងការយល់ដឹងនិងការកសាងសមត្ថភាពនិងប្រព័ន្ធគ្រប់គ្រងកំពុងត្រូវបានគេយកចិត្តទុកដាក់
SSTC started out with a bottom-up approach, building relationships through small clinical projects in one public hospital. Now we're able to approach our work from the top down as well, as we have demonstrated speech therapy's value and developed resources, connections, data and stories. Through working on establishing dysphagia programs delivered by Cambodian clinicians, for example, we more deeply understand the complexities of creating sustainability in this particular context. For a program to have true resilience, however, clinical systems ultimately need multiple locally based support structures, such as Cambodian research into the speech and language therapy needs here, or clinical and legal guidelines to help shape decision making, or career or professional development opportunities for trained staff. This is why our recent MOU with the Ministry of Health was so important, as it greatly increases our ability to work from a top-down perspective as well.
To reach the partnership with the Ministry of Health and the public hospital is not a week or 2 weeks, but a lot of time to prepare through the Cambodia administrative system, which requires strict checking of all pieces of work, such as standard format, writing protocol, the meaning of what we are saying or writing in the paper, and the whole aspect of why we are applying for this partnership and what benefit to Cambodia. We need to collect all enough evidence to prove to them.